So let's dive right into understanding what asthma is and what causes it. Asthma is a chronic respiratory condition, which means it's an ongoing issue that affects the lungs and the airways. It's characterized by inflammation and narrowing of the airways, which ultimately leads to difficulty in breathing. Now, you might be wondering what exactly causes this inflammation and narrowing of the airways. Well, it's actually a combination of genetic and environmental factors. Some people are more predisposed to developing asthma due to their genetic makeup, while others might develop it due to exposure to certain environmental factors. One of the main reasons behind this inflammation is an overactive immune response to certain triggers. When a person with asthma encounters a trigger, their immune system reacts by releasing chemicals that cause inflammation and swelling in the airways. This inflammation then leads to the production of excess mucus, which further narrows the airways and makes it difficult for air to pass through, causing the characteristic symptoms of asthma, like shortness of breath, wheezing. Moving on to the next topic, let's discuss the various triggers of asthma attacks. Identifying these triggers is crucial for managing asthma effectively, as they can cause symptoms to worsen in affected individuals. So, let's delve into some common triggers that you should be aware of. First up, we have allergens. These are substances that cause an allergic reaction and are a common trigger for asthma attacks. Examples of allergens include pollen, dust mites, mold spores, and pet dander. When someone with asthma inhales these allergens, their immune system overreacts, leading to inflammation and constriction of the airways. Next, we have air pollution. Polluted air, which contains harmful particles like smoke, smog, and chemical fumes, can irritate the airways and trigger an asthma attack. In fact, living in areas with high levels of air pollution has been linked to an increased risk of developing asthma. Cold air is another trigger for some people with asthma. Breathing in cold air can cause the airways to constrict, making it difficult to breathe, and potentially leading to an asthma attack. Exercise is also a known trigger for some people, which is referred to as exercise-induced asthma. For these individuals, engaging in physical activities, especially in cold or dry air, can cause their airways to narrow and result in asthma symptoms. Lastly, stress can be a trigger for asthma attacks. When we're stressed, our bodies release hormones that can cause the airways to constrict, making it harder to breathe. So, managing stress is essential for individuals with asthma. By being aware of these common triggers, those with asthma can take steps to avoid or minimize exposure to them, ultimately reducing the risk of asthma attacks and improving their overall quality of life. Now that we've discussed the triggers of asthma attacks, let's talk about the different types of asthma. Understanding these various types can help you better manage the condition and make more informed choices about treatment. So, let's go over 4 common types of asthma. First, we have allergic asthma. This is the most common form of asthma and is triggered by exposure to allergens such as pollen, dust mites, mold spores, and pet dander. In this case, the immune system reacts to these allergens, causing inflammation in the airways, which leads to asthma symptoms. Next up is non-allergic asthma. Unlike allergic asthma, this type isn't triggered by allergens. Instead, non-allergic asthma can be triggered by factors like stress, cold air, exercise, or exposure to air pollution. The exact cause of non-allergic asthma is still unknown, but it's believed to involve a different immune response than allergic asthma. Exercise-induced asthma is a type of asthma but occurs specifically during or after physical activity. As mentioned earlier, exercise can cause the airways to narrow in some individuals, leading to asthma symptoms. This type of asthma is more common in people who already have allergic or non-allergic asthma, but it can also occur in people without any history of the condition. Lastly, we have occupational asthma. This type of asthma is triggered by exposure to specific substances in the workplace, such as chemical fumes, dust, or animal proteins. People who work in industries like manufacturing, farming, or animal handling are at a higher risk of developing occupational asthma. Each of these types of asthma has its own set of triggers and risk factors, making it essential to understand which type you or someone you know may have. This way, you can tailor your asthma management plan to address those specific triggers and reduce the risk of asthma attacks. Now that we have a better understanding of asthma types and triggers, let's explore the various treatment and management options available for people living with this chronic condition. It's important to remember that while there is no cure for asthma, it can be managed effectively through proper treatment and lifestyle adjustments. First and foremost, we have medications. There are two main types of asthma medications: quick relief medications and long-term control medications. Quick relief medications, also known as rescue inhalers, help to relieve asthma symptoms when they occur. These medications work by relaxing the muscles around the airways, allowing them to open up and make it easier to breathe. Long-term control medications, on the other hand, are taken daily to help reduce inflammation in the airways and prevent asthma symptoms from occurring in the first place. Inhalers are another essential tool in asthma management. There are various types of inhalers, including metered dose inhalers, dry powder inhalers, and nebulizers. Each type delivers medication directly to the airways, helping to reduce inflammation and improve breathing. Lifestyle changes can also play a significant role in managing asthma. This may include avoiding known triggers, maintaining a healthy weight, exercising regularly, and practicing stress reduction techniques like meditation or deep breathing exercises. By making these adjustments, individuals with asthma can minimize their risk of experiencing symptoms and improve their overall quality of life. Creating an asthma action plan is another crucial step in managing the condition. This plan is a personalized, written document that outlines the steps to take in case of an asthma attack, as well as daily management strategies. It should include information on monitoring symptoms, using medications, and how to recognize when it's time to seek emergency care. In conclusion, effective asthma management involves a combination of medication, inhalers, lifestyle changes, and a personalized asthma action plan. By following these guidelines and working closely with their healthcare provider, individuals living with asthma can successfully manage their symptoms and lead fulfilling, active lives. Lastly, let's discuss the importance of early diagnosis, proper monitoring, and ongoing education in managing asthma and improving the quality of life for those living with this chronic condition. Early diagnosis is crucial because it allows individuals to start treatment and management strategies as soon as possible, which can help prevent the condition from worsening over time. When asthma is left untreated, it can lead to persistent symptoms, a decreased quality of life, and even permanent lung damage. Therefore, it's essential to seek medical attention if you suspect you or a loved one might have asthma. Proper monitoring is another vital aspect of asthma management. This involves regularly assessing one's symptoms, lung function, and response to treatment. Monitoring can help identify any changes in asthma severity, which may require adjustments to the treatment plan. It can also help individuals recognize the early signs of an asthma attack, allowing them to take prompt action and possibly prevent a severe episode. Ongoing education about asthma management is equally important. Staying informed about the latest research, treatment options, and management strategies can empower individuals with asthma to take an active role in managing their condition. This includes learning about their specific triggers, understanding how to use medications and inhalers correctly, and knowing when to seek emergency care. In summary, early diagnosis, proper monitoring, and ongoing education are all vital components of effective asthma management. By prioritizing these aspects, individuals living with asthma can better manage their symptoms, reduce the risk of severe attacks, and ultimately improve their overall quality of life.